Welcome to CBS This Morning. We're going to begin with the urgent new efforts to fight the pandemic, which Dr. Deborah Birx is now calling the worst event in American history. Think about that for a second. California is mostly back in lockdown mode this morning with an order affecting 30 million people there. It's the first state to lock down again. Hospitalizations in that state have tripled in the last month.
California recorded more than 30,000 new cases in a single day yesterday. That is the highest single-day total in any state so far, and many other states are seeing a troubling spike. Our lead national correspondent, David Begnaud, is in Reno, Nevada. David, good morning to you. What's the situation there?
Well, Tony, Nevada now leads the nation when it comes to the number of people who are hospitalized with COVID on a per capita basis. And here at Renown Regional Medical Center, look at what they have had to resort to. They're putting patients in their parking garage. This is a COVID ward. Now, we're nowhere near the patients, but they set this up back in April, hoping to never have to use it, but they started running out of space at the main hospital, and so this is what it has come to. You know, when pictures of the parking garage first surfaced a couple of weeks ago, some people suggested it was fake, so we called them and said, can we see it? And they said, come on over. We'll show you just how real it is.
Look at this. Where cars would normally be parked, there are now patients. 265 have come through this field hospital in just the last 3 weeks.
When you have to resort to a parking garage, you know things are pretty bad.
That means this is real.
Dr. Jacob Kieperman had just started his job here as an ICU doctor 3 weeks ago when he tweeted a picture of the parking garage turned field hospital right before patients arrived. Now, some on social media seized on the empty beds, suggesting it and the pandemic were fake. And one of those posts was retweeted by President Trump.
It was sad, disappointing, and frankly insulting.
The rampant spread of misinformation across the country is complicating efforts to control the pandemic. That's according to Dr. Deborah Birx of the White House Coronavirus Task Force.
And so I hear community members parroting back those situations, parroting back that masks don't work. This is not just the worst public health event. This is the worst event that this country will face.
To California now, where rising hospitalizations led to more regional lockdowns Sunday night by order of the governor. This affects more than 30 million people. Starting today, salons are closed, retailers are under strict capacity limits, and all dining, indoor and out, is suspended through Christmas.
If I'm not open by February, I will no longer be here. My restaurant cannot open for to-go.
Restaurant owner Angela Marsden is among those pleading with state leaders to change their rules after she noticed an outdoor dining tent for a film crew 15 feet away from her now closed outdoor patio.
Tell me that this is dangerous, but right next to me is a slap in my face.
The way it works in Los Angeles is that county officials classify video production work as essential and require regular COVID testing at TV and movie shoots. Back here in Nevada, where we are this morning, casinos and restaurants have a 25% capacity limit. Nurse Janet Baum says her hospital, which is the only one servicing 100,000 square miles, has never been busier than it is now.
Never in my wildest nightmares would I ever have thought that we would ever see something that would be killing this many people.
Janet works here at Renown Regional Medical Center, which services not only northern Nevada, but part of northern California and even Idaho. This hospital is central to this area, and now they're using a parking garage because they've run out of room. One more thing before we go. The UK is set to start injecting people with their coronavirus vaccine as soon as tomorrow. And Anthony, later in the week, the FDA should give us an update on the Pfizer vaccine. And if all goes well, they could get approval within 2 or 3 days after that.
Yep. Fingers crossed, David. Thank you.